many people just ignore bleeding gums without realizing it's already a warning sign. Kaya nga nagtataka minsan ng pasyente, Doc, bakit umuuga yung ngipin ko? Underneath your gums, there's a lot of deposit. We call it, on the layman's term, you call it tartar. Which is akala ng patient, it's just normal that there's bleeding when the patient brush. Yung atherosclerosis kasi, when we say atherosclerosis, that's build up of fatty plaques on the arteries. Then suddenly, the patient pwede magkaroon ng stroke or heart attack. Pwedeng magkaroon ng preterm birth, low birth weight ang baby because of these bacteria, no? And because of these inflammatory cells which is present when you have periodontitis and you are pregnant. Once you are a periodontitis patient, you are a periodontitis patient for life. Bleeding gums are never normal. It's your first sign that something deeper is happening. How does this disease develops and how we treat it before it becomes something serious? They say the eyes are the window to the soul, but the mouth, it's the gateway to your health. Welcome to my podcast, Beyond the Brush. I am your host, Dr. Mia Ann Villanueva Perez. Today, we discuss something more silent than cavities. A disease that quietly destroys your gums and bone health and your overall health. This is called periodontal disease. So this topic is very important because periodontal disease doesn't just affect your gums. It affects your bone, your overall health, and even your heart and pregnancy outcomes. So many people just ignore bleeding gums without realizing it's already a warning sign. So let's break everything down simply. So what happens under your gums? How does this disease develops? And how we treat it before it becomes something serious? So what exactly is periodontal disease? Usually, it starts with gingivitis. Gingivitis is presence of inflammation of gums, presence of bleeding in gums. And if you left it untreated, it would lead to periodontitis. When we say periodontitis, it's the inflammation of the gums and the bones. So there will be presence of bacteria causing infection, destroying the bone, destroys the bone that keeps your teeth together, so it would not fall apart, to keep your teeth steady or stable. So with this bacteria, it eats the bone. So it would cause tooth mobility. Kaya nga nagtataka minsan ng pasyente, Doc, bakit umuuga yung ngipin ko? Without caries, without cavity, wala namang problema eh. The tooth just become mobile. This is the warning signs. So why is it called a silent disease? Because it progressively, quietly, without the patient knowing that he or she has periodontitis. Because there is no drastic or dramatic changes. It's so slow and not sudden. So it starts with bleeding, which is akala ng patient, it's just normal that there's bleeding when the patient brush. There's also bad breath, which patient knows na mawawala din naman when I brush or when I gargle or rinse with mouthwashes. So it doesn't happen overnight. So it's very slow in progress. That's why it's a silent disease. When we say periodontitis, or periodontal disease, or gingivitis, actually the body has the capacity to adapt to long-term, low-grade inflammation. So unlike cavity, kasi pag may cavity ka, it irritates the nerve or the pulp of the tooth, then you can feel the pain. But here in gum inflammation, it doesn't reach the pain receptor deeply or suddenly that enough to trigger and causes pain. So the patient doesn't know na meron na pala siyang periodontal disease. So what happens under the gums when it worsens? So una, there will be pocket formation. So when we say pocket formation, underneath your gums, there's a lot of deposit. We call it, on the layman's term, you call it tartar. Calcular deposit. Kakaroon din tayo ng gum detachment. When we say gum detachment, yung gums become recede or loose dun sa attachment with the tooth. So there will become bone loss, presence of bone loss. Kaya bakit nagkakaroon ng tooth mobility? So this bacteria of the periodontal disease can also affect your heart, your lungs, even the pregnancy outcomes. Paano naapektuhan or how does this bacteria affect the heart? Kasi parang ang layo, no? It's in your mouth and suddenly it goes to your heart. Well, actually, there's a particular bacteria, we call it the P. gingivalis or the Porphyromonas gingivalis. This specific bacteria contributes to atherosclerosis. So when it goes to your bloodstream, it can contribute to your heart. Yung atherosclerosis kasi, when we say atherosclerosis, that's build up fatty plaques on the arteries. Then suddenly, the patient pwede magkaroon ng stroke or heart attack. So those kind of bacteria can contribute to heart problem. So when a bacteria from infected gums can travel directly to the airway. So especially with people who has pneumonia, COPD, or what we call the chronic obstructive pulmonary disease. When the patient inhale or the oral secretion, possible it will go directly to the lungs. So those can exacerbate more the worsen the presence of pneumonia or COPD. When we say naman on pregnancy, no, periodontitis doesn't actually infect the baby or the fetus, but the inflammation itself produces effects on the mother who is pregnant. When we say kasi when you are pregnant, then you have a presence of periodontal disease or periodontitis, we have the so-called inflammatory mediators. So when those inflammatory mediators such as the prostaglandins, the cytokines are increased in level, ang mangyayari kasi pwedeng magkaroon ng what we call premature uterine contraction. Pwedeng magkaroon ng preterm birth, low birth weight ang baby because of these bacteria and because of these inflammatory cells which is present when you have periodontitis and you are pregnant. So how do we diagnose periodontal disease? So we have the so-called gum health mapping, or we measure the bone loss, we check the clinical attachment levels, the attachment of the gums using a probe. A probe is an instrument used to measure this bone loss and these gums, no? So with the help of gum health mapping, or we call it on our term is periodontal chart, we can able to diagnose the patient. If the patient has gingivitis, or what stage or grade is the patient on periodontitis, and from that we can be able to do a treatment plan. So we have different kinds of treatment options for patients who have gingivitis or periodontal disease or periodontitis. So we have the so-called non-surgical scaling and root planing. So from the term non-surgical, walang surgery na mangyayari. We're going to clean the tooth thoroughly. Hindi lang sa labas, but also we do scaling and root planing. In layman's term, you call that as deep cleaning. If that fails, we also have the surgical option if it's needed. We call it the surgical scaling and root planing. This is more on open flap. The dentist or the periodontist can be able to see the tooth or until to the root part and remove all the deposits. So we also have perioplastic surgery, wherein we're going to do bone grafting, tissue connective graft, when there is at least around 6mm gum recession and above, and there's also a presence na ng bone loss. So it's very important to have early treatment and early detection. First, we can save the tooth. We can restore the gum stability. We can prevent the tooth bone loss, and we can also protect the systemic health. We can also avoid the recurrence of this disease. Actually, one of the questions of my patient would be, Doc, when I do this treatment plan, is my periodontitis will be gone, or I will be able to be healthy patient na? So actually, we have the so-called stable periodontitis patient, wherein once you are a periodontitis patient, you are a periodontitis patient for life. It's like having diabetes. you have maintenance. Same goes with periodontitis. When you have periodontitis, you will be having maintenance. So what are these maintenance? Usually, the maintenance is good oral hygiene. You have to see your dentist at least every 3 months. It's much better if you're going to see us every 3 months if you have periodontitis. 2 to 3 months would be the recall. We're going to do non-surgical scaling and root planing before we do or move to the surgical part when everything else fails. So, to wrap things up, the most important reminder is this: bleeding gums are never normal. It's your first sign that something deeper is happening. By understanding periodontal disease early, you protect your smile, you protect your overall health. For that, thank you for watching Beyond the Brush. Don't forget to follow this podcast for more educational episodes.